I'd like to invite Dr. Andrea Frolick to come forward and to share with us the work that she's completed over the last 2 years.
Thank you very much for this opportunity. Before I start my slides, I just want to say a big thank you and a deep bow of gratitude to AMS Phoenix and really your support for me during a 3-year process. So I wasn't able to complete my fellowship in 2 years because at exactly the time that my fellowship was coming online, the Supreme Court did this remarkable thing where they decriminalized medical assistance in dying. And as the director of the Office of Clinical and Organizational Ethics at Hamilton Health Sciences, I was charged with creating an assisted dying program. And so it's been an enormous preoccupation in my life and work, but it has been an opportunity to really integrate the research that I've been doing into practice within that program. So thank you to AMS for your belief in me and for giving me extra time and for your patience. So let's begin. I really want to acknowledge that this is a group effort. I'm representing an incredibly engaged group of researchers and leaders in my organization. Kirsten Kroll is my boss and cheerleader. Dana Tikic is my teacher in terms of organizational resilience. Marilyn Switten, Jill Horning are members of my research team. So this is who we are called to be. There are so many threats to compassionate care in our current healthcare system, but patients and families need us to be the rock in the raging river of their suffering and loss. And the driving question of my fellowship has been, what diminishes clinician resilience and what grows it? And how can we hardwire resilience into our systems? So I pursued 2 related themes in my research. First, we looked at expanding the range of mindfulness-based interventions in our healthcare system. And then we completed a mixed method study of the longitudinal impacts of these interventions for patient care, teamwork, and clinician wellness. We also conducted a comprehensive review of the literature from neuroscience and psychology regarding practices that support resilience for workers in high trauma environments. And from this work, we developed an ecological model of organizational resilience that can truly sustain a system to enhance quality of care for patients and quality of work life for professionals. This painting feels a lot like the work I do in medical assistance in dying. We hold patients with their intolerable suffering, but we too suffer with them, especially with the uncertainty and scrutiny surrounding this new practice. And in our program, we have baked in many of the concepts from this research to create a resilient clinical service that delivers whole person care for everyone touched by MAID. The expectation that we be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to walk through water without getting wet. And yet we tend to deny as professionals that we're touched by the suffering we encounter in our work. But our evolutionary history and neurobiology mean we are wired to respond to the stresses and rewards of care in certain ways. And Pat Fisher is a psychologist who's described the complex stress of helping work. In addition to the regular stresses of any workplace, we have the additional stress of direct trauma, such as assault, and indirect trauma, such as hearing stories of loss and suffering. It's a known workplace hazard, and yet none of us were trained or provided resources to mitigate this hazard. Stress isn't a bad thing. We need it to learn and grow and create an optimized performance, and doing caring work can be incredibly exhilarating. But after a stressful encounter, our bodies need adequate time to return to homeostasis. Unfortunately, we work in systems where fight-flight response is being constantly triggered, leading to chronic stress. And chronic stress changes our brains. Our amygdalas are constantly triggered, and it cuts us off from the part of the brain that enables care, compassion, and connection, the prefrontal cortex. We have workplace safety practices to protect us from infection and needle sticks and skeletal injuries, but we have little in place to protect us from neurological injury that comes with chronic exposure to trauma. And we see the consequences of this everywhere. Colleagues who are numb, apathetic, or hostile to their patients, rising absenteeism, plummeting morale, and it impacts patient safety and care. These are totally predictable outcomes of chronic complex stress, and yet we treat it as a personality flaw rather than a natural consequence of exposure to stress. There are a range of clinical sequelae that flow from complex stress. The risk factors are very individual and contextual, but these are all normal or expected outcomes of helping work, especially where workers have limited opportunity to return to homeostasis after trauma. Here's what it looks like when all of the sequelae of complex stress coalesce. This place in the center of the Venn diagram has no clinical diagnosis, but I call it soul collapse. Soul collapse is what happened to me this year. After 20 years of clinical practice, and exposure to overwhelming trauma I had experienced as a professional, I took a leave of absence. And don't get me wrong, I love my work, and I love end-of-life work, and I was doing all the right self-care, but the structures supporting this program were unsustainable. And when I got back to work, a colleague shared this wisdom with me, and at that moment, I decided to use an ecological model we'd been developing in theory to create a sustainable system. The ecological model of resilience in high trauma environments that we've created starts with the basic assumption that the health of an individual is intrinsically connected to the health of the entire ecology surrounding that individual. This means that resiliency needs to get hardwired into the ecology of clinical practice. It's not something a person can do for or by themselves. And so building a resilient healthcare workforce needs to be grounded in neurobiology and the recognition that our bodies have evolved with a particular wiring that can facilitate or impair care. Resilience needs to get built into organizational structures like workload and scheduling and leadership development. And then individuals are supported through individual cultivation of practices to support resilience. But for too long, we've made resilience and clinician wellness the responsibility of individuals, shaming and blaming people who experience the sequelae of complex chronic stress. And instead, we need to create these ecological systems that surround and protect the tender hearts of our healthcare workers. In our study of the longitudinal effects of mindfulness-based interventions for healthcare workers, our participants emphasized the power of mindfulness to create a space of renewal in the midst of busy clinical work. The practice of pausing and resetting is a powerful tool to enabling them to be that rock in the raging river for themselves, their colleagues, and patients. And our participants said that mindfulness boosts their resilience and in doing so enhances their capacity to experience true compassion, care, connection, and fulfillment in their work. They describe many positive aspects of the quality of care they provide, demonstrating that self-care and care for others are essentially two sides of the same coin. Thich Nhat Hanh has a famous phrase, "No mud, no lotus." This means that beauty and insight usually spring from the muck of life, and I have lived this truth over the past year. The experience of Soul Collapse yielded incredible insights about what it means to create true sustainability and resilience in healthcare from the inside out and from the outside in. So now a new day is dawning in my hospital. The fire of resilience is already catching. We're integrating this ecological model and resilience practices into our human resources strategic plan, quality councils, leadership, and crisis management systems. So let me say how grateful I am for the support of AMS and this fellowship. You have enabled me and this brilliant team of collaborators to foment a revolution in care that will continue to unfold for many years. Thank you. Namaste.